Okay, ready for a deep dive into something that's actually more common than you might think.
Hmm. Yeah, tell me more.
So we're talking about cataract surgery.
Okay. Cataract surgery. Got it.
And get this, it's the most common surgery in the U.S.
Wow, really?
Yeah.
I had no idea. You don't really hear people talking about a cataract surgery that much, so I wouldn't have guessed that.
Exactly. And it's something that a lot of people will face as they get older. You've obviously been doing your research on this one.
Yeah, I've been reading up on it, definitely. It's one of those things like you hear about it, but never really know that much about it.
So are you ready to become an expert?
Well, I don't know about an expert, but I'm definitely ready to learn more, especially because, it's not like it used to be. The technology they use now is incredible.
Exactly. But before we get into all that, I think it's good to start with the basics. Basically, think about the lens in your eye like a camera lens.
Okay, yeah.
For you to see clearly, that lens has to be crystal clear, right?
Right. Makes sense.
But then a cataract develops and the lens gets cloudy.
Like if you got a smudge on your camera lens or something.
Exactly that. And that's when you start to notice problems with your vision.
Makes sense. What kind of problem? I mean, besides things being kind of blurry.
Yeah, so colors start to look faded. Things might seem hazy. You may even see halos around lights.
Oh, wow. I didn't know that was a symptom.
It can be. And, at first it might just be a little annoying.
Yeah, I can see that.
But as it progresses, it can get harder to do things like driving at night, reading, things that are essential.
You're right. Those things would be tough.
It really affects your quality of life, which is why they do the surgery.
So how does the surgery even work?
It's actually a really common procedure. They just remove the cloudy lens and replace it with an artificial lens called an IOL.
They can actually replace the lens in your eye.
Yeah, it's done as an outpatient procedure and is super quick.
Wow. That's amazing when you think about it. Like, they're actually swapping out a part of your eye. It's not just your grandparents' cataract surgery anymore.
Oh, it really isn't. They have so many different options now, which I'm sure you saw in your research.
Yeah, there is definitely a lot more to it than I realized.
So, are you ready to get into the different types of surgery?
Let's do it.
So, you've done your homework on this, and I'm sure you noticed that there are actually different types of cataract surgeries.
Yeah, I saw that. It wasn't just one thing.
Right, it's not one size fits all. Like anything else, you want to make sure you get the right one. It's kind of like picking the right tool for the job, right?
Makes sense, yeah.
So, for example, there's something called phacoemulsification.
Say that again?
Phacoemulsification.
Phacoemulsification. Okay, I think I almost got it that time. What is that exactly?
Basically, it just means they make a really tiny incision in your eye,
Okay.
and then they use ultrasound to break up the cataract.
Wow, they use ultrasound during eye surgery.
Yep. Pretty cool, right?
That's wild. And is that the most common way they do it?
It is. And because the incision is so small, it heals a lot faster.
That makes a lot of sense. I mean, smaller incision, faster recovery, right?
Exactly.
Yeah,
Which is really important for getting back to your routine and everything.
definitely. So what about these other types of surgery?
Right. So there's also extracapsular extraction.
Okay.
And with that one, the incision is a little bit bigger
Oh, okay. How come?
because they have to remove the cataract in one piece. And then there's laser surgery.
Laser surgery. So they use lasers on your eye.
Yep. They use highly focused beams of light to do the procedure.
So are lasers better than ultrasound? Or is it just a different way of doing the same thing?
Well, lasers are more precise.
Ah, that makes sense.
Yeah, so they can do the surgery through even smaller incisions.
Wow. It's incredible what they can do these days.
I know, it really is amazing. Now, we've talked about taking the old lens out, but what about the new lens they put in?
Right, the artificial one.
Exactly. That's called an IOL or an intraocular lens.
IOL. Got it. And there's different kinds of those too, right?
Right. This is where it can start to feel like you're choosing something off a menu. You've got your monofocal lenses.
Monofocal. What does that mean?
So monofocal lenses are great for seeing things far away,
Okay.
but you might still need reading glasses for anything up close.
Oh, okay. So you might still need glasses after the surgery.
You might, yeah. Then you've got multifocal lenses, which are kind of cool.
Multifocal lenses. What's the multi part about?
Multifocal lenses do sound pretty great.
They do. It really is amazing what they can do with these lenses now.
I know, right? But I guess, like with anything, it's about weighing the pros and cons.
Right, for sure.
And making sure you have all the information so you can decide what's best for you. So let's talk about potential risks.
Okay, yeah.
Yeah.
Are there a lot of risks with this surgery?
Well, no surgery is 100% risk-free, right?
Of course.
but cataract surgery is considered to be very safe.
Okay, that's good to know.
But one of the things that I saw come up a few times in the research was something called posterior capsular opacification.
Posterior capsular. What was it again?
Posterior capsular opacification. They call it PCO for short.
Okay. PCO. And what is that?
So basically, it's not that the cataract comes back.
Okay.
It's that the capsule that holds the new lens in place can sometimes become cloudy.
So the lens is fine, but the part holding the lens gets cloudy.
Exactly.
And then what happens? Can they fix that?
Yeah. They can usually fix it with the laser,
Yeah.
and it's painless.
Oh, okay. So it's not ideal, but it's an easy fix.
Exactly.
Is it common to happen?
It's pretty common, yeah. But like I said, easily treatable.
Good, good. Are there any other complications that people should know about?
Well, there are always general risks with surgery, like a chance of infection or inflammation.
Right.
But those are really rare, especially with a routine surgery like this.
Okay, good, good.
Yeah, and of course, your doctor will go over all of the potential risks and benefits with you beforehand.
That makes sense. So you know what you're getting into.
Exactly. And speaking of things to get into, let's talk about the elephant in the room cost.
Yeah, that's a big one. How much does all this cost?
Well, the good news is that it's usually covered by insurance.
Oh, really? Even the fancy laser stuff.
That depends on your insurance. But they usually cover at least part of the cost of the surgery.
Okay, that's good to know.
But yeah, definitely something to check with your insurance beforehand.
Absolutely. Make sure you know what you're responsible for before you go in for surgery.
Exactly. Don't want any surprises.
Definitely not.
Now, before we finish up, I did want to touch on one more thing. I know you've been reading up on all this, and
Yeah.
I'm curious, did you see anything about alternatives to surgery?
Alternatives to surgery. Well, I did see something about eye drops they are researching,
Oh, yeah, those. That's right.
but it sounds like it's still in the very early stages.
Yeah, it'll probably be a while before those are available. But it's really interesting, right?
Definitely. It really shows how much things are advancing all the time.
I know. So there you have it, cataract surgery. You are now basically an expert.
Well, I don't know about all that, but I definitely learned a lot, more than I ever thought I would know about cataracts, that's for sure.
Well, I'm glad. And now, hopefully you feel empowered to have a really good conversation with your doctor.
Absolutely.
Ask the right question.
Right.
And make the best decision for you.
I will.
Yeah.
Thanks to you. And hey, maybe next time we can do a deep dive into those eye drops.
Maybe we will. That's all the time we have for today's deep dive. Until next time.